Good evening, ladies and gentlemen. Thank you so much for joining us this evening. My name is Muriehi Mulekwa. I'm going to be the moderator for this session this evening. This is not our first session coming together through Thando platform. It is our second session looking at the issue of gender-based violence. Today's topic is the impact of gender-based violence on mental health. And I am not alone. We do have three esteemed guests that have allowed us the time to come and discuss with you today. If I can have the moment to quickly introduce them so that you know who are the people that are going to have this conversation with me, not only from South Africa, but also from Zimbabwe. And I do know that our audience, we are speaking to an African audience, we are speaking to a global audience. So thank you so much for your time. Thank you so much for coming to engage with us, whether it's through Twitter, it's through Facebook, or through our Instagram page. We really appreciate your time. This evening, I'm joined by Dr. Steve Kanda. She is based in Zimbabwe. She has been practicing medicine in the clinical and public field for the past 11 years in Uganda, Kenya, and Zimbabwe. She is the founder of Afrofeme Wellness Program, which helps the African woman in her personal journey towards mental and emotional wellness, so that she may be the bravest version of herself. I hope I am that woman. Dr. Steve, welcome, and thank you so much for being with us.
Thank you so much, Mo. Good to be here.
Great stuff. For those of you who are following us on the social media channels, these are the handles that you can follow us on. Dr. Steve, you can find her at Afrofeme. It's AFROFEMME_. That is the Twitter handle that you can follow the conversation on. Also on Thando channel on Twitter and all the other platforms, Facebook as well as Instagram. It's at Thando channel. We would love for you to follow. We would love for you to post your comments as well as your questions so that we could have any meaningful engagement. Second up, we have Dr. Mwegezitepo Mati. Dr. Mati is South African. He is the general practitioner and founder of Dr. T.M. Mate Practice. He is a part-time lecturer at the University of Witwatersrand. He attained his diploma in HIV management in 2006. His area of interest is HIV in youth and women. He places a strong emphasis on preventative medicine and sees every patient encounter as an opportunity to screen and promote good health. Ndatemat, Rao Amuhela, good evening.
Good evening, thank you. Thanks for this.
Awesome. Last but not least, we have Jenna Beya. Jenna is based in South Africa. She is a counseling psychologist and a mediator. She has experience in education, business, and NGO sectors, as well as youth, working with various parastatal and government departments. Her experience includes individual and group therapy, trauma and career counseling, psychometric testing, and employee wellness. She believes strongly that mental health is a human right issue. Jenna, welcome to Thando channel.
Thank you for having me. I'm very excited. Thank you.
Great stuff. Just for consistency, Jenna, you can follow her on Twitter. It's Jenna Bayer 6, JENNABAYER, and the number 6. And Dr. Mate, you can follow him on Dr. M. Mate. That's his Twitter handle. Dr. DRMMATHE, Dr. Mate on Twitter handle. Just before we start, I thought it would be appropriate for me to read this quote or this line from the stage production, We Are Dying Here. It says, every step taken in the street is a prayer to not be seen. Every prayer made by a woman in the street is a question to God. Every breath taken by a woman upon her arrival is a sigh of relief. What will it take for him to stop? As if we are challenged to be conquered. What will it take for men to stop? This is like a prayer that most women pray, especially during this time where we have seen an increase in gender-based violence during the pandemic, the COVID-19 pandemic, that has forced us to be socially distanced in terms of where we live. We have been under lockdown across the globe. It's not just a South African thing. It's not just an African thing. It's a pandemic that came across all of us across the world, and it has forced us to really look at things, the demons within ourselves, very, very closely. And one of those is gender-based violence. And obviously, the impact of it on women and young girls has been shown. Statistics show that this is something else. This is a pandemic. As we are facing COVID, we've been asking and we are pleading that gender-based violence be seen as a pandemic itself. And I must say that it's very, very encouraging to see that finally our government in South Africa in particular have paid attention to this. They have passed bills that are basically going to allow the law in terms of sexual offences and related matters to be able to look at this issue deeply. The president made this announcement last week, Monday, and it was well received. But at the same time, obviously, we do believe that this is long coming. It took them way, way too long. Lots of lives were actually, taken too young before we could be able to take this step. So with today's session, we are looking at a different part of the impact of gender-based violence, the mental wellness, the mental health. I do not want to take it for granted that we all know what this means. That's why we do have this esteemed audience over here, whom I'm now going to give a chance, because they come from various sectors within the health space, to explain to us in their own words and in their own understanding and in the areas of practice how they have come across mental health and how it has been exacerbated by gender-based violence. I will start with you, the thorn among the rose here, which is Dr. Marty, for him to let us know what has been his experience, because he comes also predominantly from the HIV/AIDS sector. What has been his experience? Dr. Marty?
Thank you so much. Thank you for this opportunity. I must say, when I was asked to be part of this panel on this, I thought to myself, this is a big topic, because it encompasses so many different things and things that we in general practice see all the time. I mean, I'll give you a typical example of what I see. It is well understood that if you look at health-seeking behavior, women are very good at seeking medical help, and men are particularly bad at it. So if you understand that a doctor's room is most likely to be filled by women as opposed to men, it stands to reason that if in a partnership somebody is going to pick up a disease, it is most likely to be picked up first by the woman because she seeks help early. And what I have found in the HIV space is that when it comes to couples, whoever is diagnosed with HIV first, it's blamed for bringing it into the marriage, which of course isn't necessarily true. But by virtue of the fact that men have such bad health-seeking behavior and women so good, I often diagnose it in women first. And whoever gets tested first then gets blamed to say, you brought this thing into the relationship. And understanding that, it has forced me to one, change a little bit how I do HIV tests, for example. So if somebody comes and they want to test, I'd first find out they have a partner. I would encourage that they come with a partner. If that's not possible, or they don't wish to do so, then I would test them individually. Because I have found, to avoid the problem of the woman being blamed for bringing HIV into this marriage, it's better to test them together. So that understanding of the violence, although it may be not physical but emotional, the violence that comes with that initial diagnosis by a woman is something that I'm actively trying to avoid in my practice. So as I said, this is a massive topic with a lot of implications.
Wow, you already bring a certain dynamic to this altogether that one need to look into. So definitely, I think every time we host this session, we realize that they become topics on their own. They build as we go along. So thank you so much for bringing that part where it's important that you break the divide and you bring that about equality and the fact that we don't infect ourselves. There are various ways that people get infected. So finding out and not blaming, it's very, very important. Jenna, in your space as a psychologist, how has the issue of mental health played itself? How has gender-based violence become the cause, or do you see that it's the cause leading to a lot of mental health illnesses? Or what has been your experience?
So my experience is that most clients whom I've helped in my 10 years have been victims of gender-based violence. And the mental illnesses that play itself out, or the symptoms that I notice, such as nagging self-criticism, depression, anxiety, relationship problems, panic attacks, social withdrawal, all those symptoms play themselves out because most of these clients feel trapped in fear and worry and anxiety because there's a fear of speaking. In other words, a patriarchal society requires your silence. A patriarchal society endorses violence. And so because of this is why I've become really interested in human rights, because most of these clients don't know what their rights are, and they feel most liberated when they speak their truth. In fact, for me, the greatest therapy is speaking your truth. And so that's how it plays itself out, or the illnesses play itself, where they are persistently worn down. It's like taking a cricket bat and a pillow and smacking the pillow until there's nothing left inside the pillow. And so when they come to therapy, it's highly self-critical, anxious, fearful, even suicidal. That's why you have to look at mental illness from a multimodal perspective. Don't just see isolated incidents. Look at it psychologically, socially, physically, politically, etc. And this is why I align myself with human rights organizations, because where there is gender-based violence and mental health issues, there is usually a human rights violation as well.
Wow. I just love how you're really leading to some of the hot spot in terms of why we find ourselves in this particular space. Where you're saying we endorse silence. We don't speak enough as a nation. We don't speak enough as women about what we go through, mainly because we are afraid of being judged. We are afraid of, being further victimized and abused. So you rather die in silence instead of finding support, and instead of, shining the light on what you are going through. And as we, later on, we would find out what can we do. Are there centers, are there places where women can go, where there will be a safety for them to actually engage and to talk, and to really, really find that space where they could heal, because we do go through a lot. And Dr. Stay, I think this comes through into your space nicely when you are looking at the woman holistic well-being and trying to make the person the bravest that they can be. How do you do that? How do you help a woman who comes through and they've been battered, and their self-esteem has literally been diminished? What has been your experience?
Thank you so much. So maybe I need to explain a bit of what Afrofem does and how it came about, so that I can explain how we see these women coming in. So at the beginning of the lockdown, we found there was a huge gap, or an opportunity, I should say, on the online space for communities to be built up. And we formed a community of African women, not African as in Black women, but women whose origins are in Africa and can be anywhere in the world, who connected with similar struggles, similar mental wellness issues and realize that there's strength in numbers, there's strength with community and support, because we are pretty much going through the same things but not realizing it, because when you're isolated in your home, you think that this is only happening to me. So one of the huge moments of realization was that there's a gap in awareness. We know, we define these over and over again, but you don't realize that what you are going through, that is a problem. That is not normal. And the awareness is the first step. And that was one of the, what Afrofem does is try and raise the awareness in women. And the most educated, the most well-off, it didn't matter what these women had, the background, they were still struggling when it came to mental wellness issues. And after awareness, it was about action. What then do I do if I have a problem? They were stuck. They didn't know what to do. And even those who knew what to do, they don't know what to do about it. They cannot access services. So we have huge gaps when it comes to women who are trapped in relationships, who are trapped in situations, particularly which came about with the lockdown. And they didn't know what to do. They didn't know where to go. So that is how this community came about. And we are seeing it's a problem in women, regardless of their background, regardless of status. It's pretty much the same in our African women.
Great. So, good people, thank you so much for at least drawing us in terms of what is happening within your world and your understanding of the scourge. Dr. Mati, just coming back to how can we tell if someone has a mental health problem? Are there signs, are there things that we are not aware of as a society, as communities, as women, because we speak with each other, but we never really see anything wrong with our sisters until, you know, somebody gets admitted or they commit suicide, and we start talking among ourselves to say, oh, I didn't know. You know, are there things that we are supposed to see or to know? Or is it also the conversations that we have? Are we supposed to change the conversations that we have where we become more authentic in our engagement and really be open in terms of what we are going through instead of this, you know, Instagram life where everything is perfect and it's all, you know, nice and glamorous? What would be your view on that?
I love the word you use there, authentic. Think about the last time you greeted anybody. You know, it's like, hello, how are you? I'm fine, thanks, and you. We do this greeting, but we go through it because it's expected. We're going through the motion. We never really ask the person, like, you know, nobody actually asks you, how are you? And actually expect a truthful answer. So I think the first step in identifying mental health disorder, any mental health issues, is to actually pay attention to the people you're speaking to actually care, not just ask because it's expected, but to actually want to know how that other person is feeling. You see, mental health can present either very subtly or very overtly. So if you take your obvious somebody who's psychotic, is seeing things, is hearing things, and is walking around naked in the street, that's obvious case of mental health disorder, and those are quite easy to spot. What is subtle is that co-worker who used to be the life of the office now suddenly comes to the office and you hardly know she's there. It's those small changes. You know, that person who you would crack a certain type of joke and be the first one to get and burst out. Now suddenly you crack a joke and you can hardly see they're there. It's those small little signs that one has to look out for. As a general practitioner, people usually come to me because they want help. So they would tell me, but sometimes you find that somebody comes to you and they tell you about their cough. But as they're telling you about the cough, you realize, but you know, Mudia is not as bright as she is. She's not as bubbly. You know, she's like a Coke that's been shaken and there's no more bubbles. And it's picking it up, and then you find, I don't know, how is things at home? How have you been? You look a bit down. And being down in itself is not a mental health disease, but being persistently down is a problem. You know, it's a bit like, you know, the 5 steps of bereavement. When somebody's passed away, we go through different steps. we say somebody's a mental health problem when they get stuck in a step and they cannot go beyond. So I always say, you know, you rest. Why don't you just get out of it? It's like saying somebody with a broken leg, saying that you've got a broken leg, just walk on it, you'll be fine. Mental health diseases are actually the actual physical problems with the brain. Either there's a chemical imbalance or there's a miswiring, if you want. So these are actual true diseases. It's not that people are putting it on or they're just looking for attention. So I really think the first step in picking this up is being genuine in our interactions, actually caring about the person you're speaking to. Because it's only when you do that that they will tell you what the issues are, and maybe you can then begin to have an intervention. Because the last thing you want to do is to sit around the table and say, you know, she actually was like this, as we sit chatting after a funeral because she committed suicide because we missed the signs.
Yeah, so true. And Jenna, how easy it is for people to come and be open when they come to your office, when they come for, counseling. Do they come knowing what is wrong, or is through a journey of you engaging with them, interrogating what's happening within their lives, that you come to a point where you're saying, I think now we are at a state where either you are depressed or there's anxiety that is placing itself, or we need to be worried. There seems to be a pattern of maybe there's some suicidal thoughts here. What is happening around your world? How do you get to that point? Can I, as Mudehi, just come through and feel that, you know what, I think I'm at this particular point. What's happening with me?
Well, first of all, one of the barriers to people coming through is this thing called stigma. In other words, this thing that, if you don't declare a mental illness because you're weird or wrong or bad or so there's still that to deal with. So that's why mental health education is so important. Also, when I do a lot of employee wellness, for example, there's this culture of, I don't want people to know I have a mental illness because then they'll use it against me, or I don't want my manager to know about it because then he'll think I'm not equipped for the job, or they won't consider me for promotion, and these notions that come up. So that's the first thing that happens. When a person then does come for therapy, one of the reasons people get tired or they disconnect is because they develop relationships with people's problems and not the person. In other words, they get too immersed in the problems instead of just connecting to the person and developing a rapport. Because let's say you have someone come to you who's, for example, been raped, or victim of gender-based violence. There may not be any, their trust issues are huge. You can, of course. So first and foremost, instead of worrying about, symptoms and depression, the first thing is just to develop a rapport, to develop a containing environment where they feel that you're listening to them, they can trust you, you develop a relationship, and then you build it from there, where they don't feel like they're alone. So that's the first aim. Then a real process of empowerment and a process of self-compassion, because a lot of, again, gender-based violence victims think that they were the one to blame. Or what happens is that the abuser gets it in their head that they caused it. This is a process called gaslighting, that they caused the problems. So you want to empower the person. You want to tell them to be kind to themselves and then embark on a process of self-compassion, and then a process of resurrecting their self-esteem and promoting the power of choice. Because even though you want to deal with the trauma, you still want to get into it. The concern is that if they don't resurrect their self-esteem and believe in their own power of choice, they're going to keep attracting the same problems. And so that's a big focus, is resurrecting the self-esteem and self-compassion, and believing in their right to self-determination.
And in that process, is there a time frame to this? How much time should, victims of gender-based violence and those that it's now manifesting itself in mental health illnesses, how much time should one give themselves? Because also we are living in a society where you are, you are expected to be perfect. You are expected to be operational. If you are in a work environment, there are demands on your time to operate at a certain level, regardless of what you are going through. how much space do we give attention to this particular issue, and actually build systems in place to help people that are going through mental illnesses, or that we build as organizations for women who are suffering from gender-based violence. Because this, statistics, they show that 1 in 3 women globally would have been infected by gender-based. They would have experienced some form of abuse in some way or the other. So this is something that you would think that even in our working environment, we would have put structures in place to have the safety to speak. We would have channels that people can be able to go, buddy system, things that people feel that I'm heard. I can be able to go here when I'm at work. I'm safe. Do we have enough of that, or we want people to heal quickly, or just get over it and move on?
Yeah, well, first of all, you can't want people to heal. It doesn't work that way. What you've got to do is listen to them. Your company's got to have an employee wellness provider. Secondly, you've got to have a non-discriminatory environment and a culture of listening to each other. Because what I've noticed is in companies where mental health stigma is high, discrimination is high. Whereas in companies which are supportive, mental health stigma decreases. And so that speaks to the management culture. That speaks to the manager's emotional intelligence and their ability to listen to their staff. That speaks to the manager's ability to foster a culture of listening and awareness, and instead of just this perfectionistic environment. The fact that, because you used the sentence earlier, we're required to be perfect. The fact that there is that requirement is deeply toxic and concerning, because that alone is a recipe for burnout. So we should be in an environment where we're promoting expression and performance, yes, but not perfection. Rather listening and realizing that people are holistic beings. So the reason they might not be performing might be because they're traumatized, or because there's a toxic bully culture in your organization. And that's what you then need to address. And that's why you need to have an employee wellness provider. That's why it's so important. But if the sole focus in the company is on results and performance, that's a recipe for disaster and a recipe for depression and anxiety and even suicide.
Sure. Wow. Great insights coming through there from Dr. Jenna. If you've just joined us, you are listening to Thando channel. We are having a topic on gender-based violence, the impact on mental health. I am joined by Jenna Bayer, who is a psychologist, Dr. Steve Kanda from Zimbabwe, Dr. Mwegezi Mati from South Africa. And we are welcoming all comments, all questions on our social media platforms. Please do share them, and we will be able to put you through so that you can be part of the conversation. Dr. Steve, we are faced as a continent, as a country, the triple challenge of inequality, unemployment, and poverty. But for women, on top of those 3 challenges, we now have a 4th challenge of gender-based violence. That's a lot to put on one species, one gender. How do we help women to navigate through this? Because at the same time, you also have a lot of families that are, women-headed families. Women are, the bedrock of most communities. So already we are so burdened. And then there is this issue where we are also we are abused verbally, financially, mentally, otherwise. How do we become whole beings that are able to function in society or are able to be the bravest of ourselves as Afrofeme would like for us to be?
Yeah, indeed, you're so right that we are so burdened already with the economic and our political issues in our countries. And a lot of it is that the economic issues are the risk factors for the gender-based violence. So you'll get a family that the husband or the father figure had a bad day at work. He's being disrespected. He cannot provide for his family. And the first person he's going to put it out on is the wife or the partner. And she has to just take the brunt of everything that he had to get that day. At the same time, she's trying to provide for her family. She's going through explaining to the children that it's okay, your father's just had a bad day. And there's that culture of secrecy. She cannot talk to her family. She cannot talk to her friends because she's been taught that everything stays in this home. Do not go out there. And then what happens is that we do have organizations, and you see, to try and address these issues. I'm in the public health sector, and a lot of our solutions are, let us pump money, let us empower this woman, let her become the breadwinner so she does not have to be in that situation. But what we're forgetting is, yes, we may empower her, she may become economically independent, but how does she then face her society as a single mother? How does she explain to her children that we don't live with your father, you just live with me? How does she explain to her church that she's divorced? How does she explain to her friends who are always having couple parties that I'm coming alone, and suddenly her friends are treating her different? So we need to not just look at it in a term of financial or economic, but look at the woman as a whole. What problems is she going to face culturally, in her society, in whatever sphere she is? We need to empower her, that she knows deep down that I can make it on my own, not just about money, but about everything in her life, so that she's brave enough to make those decisions, to step out and say, it's okay, I can make this, regardless of how much money I have, regardless of what people think. I believe in myself and I can do it.
Wow, awesome. Jenna, you wanted to build on that, so I see your hand is up there.
So I'm a little concerned that and I agree with all these points, of course, but I'm a little concerned that the focus is too much on what women must do. The fact is, gender-based violence is mostly inflicted on women. So it can't be for women to say, well, what must we do all the time and what must we fix? Men have to take responsibility. This includes debunking this code that men must be emotionless, helping boys, who experience childhood trauma, because they're taught not to express their emotions. And then what happens is, psychologically, they end up acting out in violence or bullying behavior at school, or vandalism and behavior such as that. Educating, from a young age, from primary school age, on mental health, on human rights, on what it is to be an active citizen, on bullying education, not just for the kids, but for the parents and the teachers as well. So when a woman can only do so much, but when a societal culture is leaning or so lopsided against her, there's only so much she can do. There needs to be a shift in consciousness in terms of the way men think about women, seeing women as objects or bodies that can just be tampered with. That's where the shift in conscious needs to come. So I don't think there should be too much emphasis on women forgiving men all the time, or women taking ownership. That's half the battle. And so I'm just a little concerned with that at the moment.
Yeah, no, you're spot on. I think in our first session, when we started with this conversation, that's why we wanted to actually go to the origin of gender-based violence, just because we realize that most of the time we are expected as women to have this conversation as if we are the people who who actually violate ourselves, but we actually do have men who are the perpetrators and are the people who need to actually take ownership, take accountability, and be able to really find a way of engaging ourselves. And also, we're even looking at the point of how do we even raise our children, our boy children, for them to take responsibility. So it is a broad conversation. It is something that also is quite systematic, that we need to find ways of dealing with these issues so that we can take the spotlight away from the woman. And for me, that was the point, that we're already caring so much, We need to find a place where we can have relief, a place where we are understood in terms of who we are, and we can find that comfort to know that there's some people or there's someone out there who's looking after our own well-being as well. Just to recognize the people that have joined us online, I've got Shingai who says, where does normal stress, burnout stop and mental illness start? Where does normal stress or burnout stop and mental illness start? I will throw it to you, my good expert, but I see Dr. Mate, you've got your hand there. Maybe you could start with that.
So I'm glad the question was asked. A little bit of what I wanted to say. Most of us as people have mental health challenges of some kind or another. In fact, I would dare say all of us have a mental health challenge of some sort. Whether it becomes a disorder or not depends on a lot of factors. It's a nature versus nurture debate. Do you have an environment that allows you to overcome the challenge, or do you have an environment that feeds into that challenge and makes it into a disorder? Anybody who's got a high stress job will know what stress looks like and will know what it feels like. And you go from just having normal stress to having a mental health problem if your normal coping mechanisms can no longer help you deal with the situation you find yourself in. So if you find that your life has to change in order to accommodate this stress that you have, there's a problem. And I think to what one of the things we need to do as healthcare professionals. Now, we know that in South Africa, largely most doctors are still, the medical profession is still largely male. It's changing very rapidly, but it's still largely male. So it becomes responsible of us to mental health challenge of some sort. When a woman comes to you, find yourself in, what we should not do is to re-traumatize them. I think that's quite important. And it's really about raising awareness, firstly amongst ourselves as men, but also amongst ourselves as male doctors, to say when a patient comes in, when a woman comes in, and she's a victim of gender-based violence, whether it's physical, it's emotional, it's financial, all of them are equally important. We often go up in arms when you see somebody walking with a blue eye. You're like, where's this man? What has he done? But a woman who's been emotionally beaten down to a pulp is just as damaged as somebody who comes in with an eye that's closed shut. So I think it boils down to, we need to recognize that all of us, if you want, are a little bit crazy. The question is, does this crazy affect our lives or not? And if the environment fits, people being in lockdown now has created massive problems. For most of us, our homes are a place of safety, they're a place of solace, a place of comfort. So you look forward to going home after being at work. But there are people for whom being at home is the worst place to be. They look forward to going to work because they leave this place. And we need to start first identifying those people that have that, to say, who of my friends, who of my patients, who of my colleagues does not look forward to going home every day, and find out why that's the case and begin to help them. So to expect that people are going to walk this journey by themselves is unreasonable. A society is made up of people. As individuals, we've got to take care of the next person who takes care of the next person. And if that keeps going, the society takes care of itself. But it starts with each individual person.
Yeah, great. Does anybody else want to add on to that before I move to the next question?
Yeah, I think just to sum up that point as well for me is that the important thing for a society to remember is that mental health is on a continuum. It's not a case of either you're mentally healthy or you're in a hospital somewhere. It doesn't work that way. It's on a continuum. And there are various risk factors that can lead to mental illness, such as, relationship problems, gender-based violence, poor justice system, inequality, bereavement, loss, your support system, physical or chronic pains or illnesses. So there are risk factors involved that can result in going down that continuum towards mental illness. So if there's a culture of stigma, if there's a lack of support, if there's a poor justice system, inequality, those are then risk factors for mental illness.
Yeah. So just to build on that, and just to understand, because we obviously are operating on a continental level here, and we do have people from across different cultures, races, and all of that. Do we provide comprehensive, gender-sensitive mental health services in any of your experience in any country that you operate in? Are we equipped to provide that support? Because we are talking about we need to, to be sensitive to what people are going through. We need to be aware and pay more attention to those who are around us. If somebody is quieter, you are able to engage and try and be that particular friend. Are we sensitive enough to such issues, or even from a public point of view, our government, in terms of the services that they provide? Are there such, or we are still a long way? Obviously, we know with gender-based violence and women being protected, that has taken us forever. We have a lot of women that still are living in prisons in their own homes, who are battered, who go to report crimes, and they are told, go fix it, go do better, go do all of those things. How do we do better ourselves outside of going to professionals, outside of going to government? What do we do? Or if somebody is right now feeling that I am experiencing some sort of, depression, I am, experiencing, abuse in my space. It can be in any form, as we already know. There are various forms of gender-based violence. How do we help them, or where do we guide them to go to, so that we also don't try and be saviors, but can actually guide a person so that they don't get further victimized? Make it.
I'd love to hear his experiences. But if you look at South Africa, your typical public health hospital, however many beds it has, will likely only have one psychologist. We say we're placing great emphasis on mental health, yet the staffing of our public health institutions does not reflect that. You may have one psychologist and two or three social workers for a 600-bed hospital, and we think that's sufficient. And then if you go to your public health clinic, your community health care clinic, there is no psychologist, there is no social worker. And the social worker is there to deal with issues of social grants and so on. So in our own budgeting of public health care, mental health has not taken a big step, and you see it in the amount of money and the amount of resources we put into it. I mean, if you were to ask, and I would challenge any CEO of any major hospital in this country, you ask them, how many of your patients of women who delivered in your hospital, how many of them were treated in your institution for postnatal depression? It'll be very few. Yet we know postnatal depression is a serious problem. So where are these people getting their help? They're not getting it in public in government hospitals. So I think, to answer your question, no, we're not paying enough attention, and no, we're not putting enough emphasis, we're not putting enough resources into mental health. And I'd love to hear what the situation is like in Zimbabwe.
Dr. Steve?
I'm so glad Dr. Mate said all these things, and I wish you were my doctor, because I actually got into this line of work because of a personal experience with postnatal depression. Being a medical doctor and knowing everything on paper of what that should look like, but being completely blind when it actually happened to me, and nobody picking it up, nobody even asking one single question to say, how are you? Or it's been 3 months now, you've been low. Do you think this is normal? So you are so right. Zimbabwe, South Africa is very similar when it comes to how much funding, how much political commitment there is to psychiatry or mental health generally. But in my experience as well, in Kenya and Uganda, similar story. So I think it's something that's very common in our continent, that we're not training psychiatrists, we are not training psychologists, we don't fund it, we're not doing enough research. It's just a huge public health gap. And maybe it's because we do have a lot of other problems with infectious diseases and now with the non-communicable diseases, and we're so overwhelmed. But somebody has to advocate for this, because there is no health without mental health. You are not going to feel better if you cannot enjoy health, your physical health. If you are depressed, if you're anxious, all that physical health will count for nothing. So we do have we don't have enough commitment to that space. I completely agree. And I really wish Dr. Mate had been my doctor that time, because it's so rare to find someone talking about PND. And it is a gender-based mental illness as well, because men don't go through it.
It's never too late, and we can be connected. We are living in a digital world, so I'm glad we can be able to already start, problem solving right here on Thando channel. Thank you so much, Dr. Mate, for that, and Steve for being open enough in terms of what you have gone through. Jenna, you wanted to add something there?
Yeah, I think the thing I want to emphasize to the public. Sorry, I'm just getting feedback from someone's. Anyway, the thing I want to emphasize to the public, and one of the reasons I think there's a lack of emphasis is because of stigma and a lack of understanding. Mental health stigma is discrimination, because the moment you put someone in a box or sideline them, and then once you do that, trample on their dignity because of it, that becomes an act of discrimination. So the fact that it's not funded, the fact that it's not invested in, speaks to a discriminatory culture. We don't regard you, we don't see you, we don't see your problem. Your problem is less. You don't matter. And this word matter is being used a lot. It's as if you don't matter. Your issues don't matter. And that then becomes an act of discrimination. Where there's mental health stigma, there's discrimination.
So Jen, how do we start to have these conversations? How do we start to be open and to see people? When you say you don't matter, that means people don't see you. They don't regard you. How do we start finding a safe space, a safe haven, to be able to say, to your point, Dr. Mate, to say, even when we greet, in Sizulu is Sawubona, I see you. How do we start seeing people and engaging with them from that space of, I want to know where you are. I want to hear how you really are doing. What are there practical steps that we could be able to share with our audience?
So firstly, sustained media campaigns, not episodic reporting of incidences, sustained media campaigns. That's number one. Two, when someone comes and speaks to you, number one, don't judge them, listen to them. Don't try and fix them or cheer them up. Listen to their story. Don't dismiss, don't minimize their problem. Don't compare their issue to yours or someone else's. Focus on their story. Listen to their story and then refer to a professional. In other words, know where your boundary is. Okay, so promote mental health services and promote the culture of listening to people and empathy. Promote a teamwork environment where anytime there's an issue, you're there to support each other. Create a safe, containing environment. Because if a person feels that an environment is not a safe and containing one, they simply won't talk to you. So a safe, containing, offer them a glass of water or something to drink, that kind of thing. Because that first thing is that they feel that they can trust you. Okay, and the moment there's stigma, people won't trust you, and then they'll start acting out in aggression, or then you have the risk of depression. So you want to first and foremost foster a culture that is a trusting environment, free of stigma, where people will listen to each other and take it from there.
Great stuff. Dr. Martin, you wanted to add on to that?
One of the fascinating things I find about stigma, and I've got esteemed psychologists there who can correct me perhaps if I'm wrong. A lot of time when people stigmatize somebody and they judge somebody, it's not so much about that person, it's more about themselves. they look at this person and they're seeing themselves in that person, and they want to rebel against that, and hence they. I mean, we saw those with HIV stigma. People stigmatize against people with HIV, but and I happen to know this because I treated someone, and some of the people who were the biggest leaders and the biggest stigmatizers were people who were HIV positive themselves. So they were doing that in order to cover up their own status, in order to hide their own deficiencies. Sometimes when we stigmatize against people who've got mental health disorders, it's because we're trying to cover and trying to pretend that we don't have the same problem. So, and I fully agree. I mean, we've got to start as a society. We've got to put it out there. We've got to have sustained campaigns. But I think it starts with a moment of self-reflection. And you asked, how do we start this? Well, you've started this journey. The fact that we're having this conversation today is a start. It's a good thing. There are people going to be having conversations when we get off this platform, having a chat amongst themselves. We've got to say to men, you know, you've lost a wife, you've lost a child. Have you sat down and spoken to somebody? Have you cried? You know, go to a friend and say, Chief, I know you have been going through a tough time. How are you doing? No, great. No, Chief, really, how are you doing? And that's why, and maybe I'm emphasizing too much on self. We've got to, you know, you can't love the next person if you don't love yourself. You can't care for the next person if you don't care for yourself. So we've got to first fix ourselves and then really, really care about the next person. Because if you don't do that, any campaign you have will just wash down. We've got to change our fundamental standing, how we see ourselves as society, as individuals within the society.
Right. I guess it's really, really true that, you know, when you point a finger to someone, there are three fingers that are pointing back at you. So, you know, the introspection is very, very important, because also you can't, even if you want to give of yourself, you can't give from an empty space. You need to also have healed. You need to have gone, dealt with your own issues, or be aware enough of your issues so you don't poison the next person. Jenna, you had your hand up. Do you still have something there?
Yeah, well, I think there are multiple reasons for the stigma. That, yes. But people stigmatize because it goes against their belief system. They stigmatize because they're afraid. They stigmatize because they don't understand it. They stigmatize because of a lack of education. They stigmatize because they don't realize it's an illness. They stigmatize because because we live in a patriarchal society. And if you're a boy, you're not meant to be behaving like this. And so that's where these conversations are so important, because once you've educated it, then the aim is to then take away that ignorance, because it's the ignorance that leads to the fear, and then fear triggers the stigma. Because when people are afraid, the defense mechanism is to stigmatize. And so that's where these educational platforms are so important.
Great stuff. Just to note some of the comments that are coming through. Pinky Matiti, she says, empathy, to be gracious in our approach, is very important. I couldn't agree more with you, Pinky. And Washington Kama, he has a question for you guys, and I would love for you to answer it. If you had 3 minutes with a president that you would advocate, what would you advocate for? Sorry, let me read it again. If you had 3 minutes with a president, what would you advocate for? So we've got 2 South Africans. You had a chance with Mr. Ramaphosa. Ste, you had a chance with your president in Zimbabwe. What would you advocate for? I'll give you a minute each.
1 minute, not 3. Mine is very simple, and it's just basically we need to be more aware of mental health, mental wellness issues. So I would advocate for mental wellness to be something which is spoken about in the media, campaigns, general political arena, any space. Then we need to have action points. What should people do when they find out they have a mental wellness issue? Gender-based violence victims, where are they supposed to go? This should be something that a child can sing. Everyone should know what to do, and there should be access. Let us have some political commitment towards mental health. Let us put mental health facilities in hospitals and public healthcare system in the primary health facilities. And if it's in the private healthcare, let it be affordable for all people. So I think it's a multi-sectorial approach. When we empower the people, when we empower the systems that are there, then we're able then to address mental wellness in that space.
Jenna, and I'll end off with you.
First thing, I'd have mental health taught as a subject in schools from primary school. Right now, it's only in universities as a choice. So there's complete lack of awareness or lack of knowledge about it. So I'd have it as a subject in schools. 2, gun legislation. So, many clients, I've often see families who've had sort of children or who've been victims of femicide. So I'd address gun legislation and the easy access of guns, and then substance abuse. So the easy access of substances, then substance abuse education for parents, teachers, and learners, and then more rehab facilities in poorer areas. Because right now, the gap between the haves and have-nots in terms of mental health services is too wide, not just in hospitals, but in schools. You could have like 3 psychologists in a private school, and in a government school, there are none. So things like that. So yeah, just access to substance abuse services, guns, and human mental health taught as a subject in schools.
Dr. Martin.
So you said I had 10 minutes with the president. Mudia, you said if I had 3 minutes with the president, yes?
A minute. I'm the president today.
Okay, so I would give the president 2 options. Either 1, make me the Minister of Health, or 2, give me 3 hours. That's honestly what I would ask for. Those are your 2 options, President. You pick.
Awesome. Well, I'm glad that we're just adding more to the president's plate. It's not like he doesn't have enough going on, but the energy, I love the energy, because I think we need to be, action orientated, solution orientated as well. A lot is looking at our government. We are looking for them to come with solutions to help our communities. But I also believe that we've got a very, very important role to play as individuals, because we are closer to the ground. We see what is happening. And just by being kind, by being around you and being an active citizen, it's very, very important. And us understanding what you have shared with us today is very important, so that we can see each other with a kinder spirit. We can love each other more, and we could be able to be empathetic to ourselves, because we are a very, very selfish nation. I think we have grown to really be all about me, myself, and I, and not, taking care of the next. So being able to have this conversation shows us that there are a lot of people who are hurting. There are a lot of people who are going through a lot. And just by asking a simple question, but with meaning, how are you? You could actually make somebody's day. You could actually help someone who's going through a very, very difficult time. We are drawing to a close. We've got 2 minutes before we end our show. Do you have any last minute, comment or a word of wisdom that you would like to give to our viewers? What is the one thing that you just want us to leave with, so that we can remember the importance of looking after our mental health, looking after those who we are with in this journey of life together? Quickly, 3 seconds each. Jenna, you can go.
So I go first. Okay. To quote Dr. Martin Luther King Jr., there comes a time when silence is betrayal. So, ladies and gentlemen, if we stay silent, then that girl who was raped may end up committing suicide. We need to help her soon, otherwise her risk of mental illness increases. We need to help her as soon as possible.
Thank you. Dr. Steve? You're on mute.
Sorry, I was trying to look for the quote. My take home is be kind. Be kind to yourself, be kind to others, be kind to the world. We all need a little bit of kindness, and you never know what someone is going through unless you're in their shoes.
Thank you. Dr. Muyeketi Mati?
I think as a man, I'd like to end with this, to say, if you are a friend of mine, you are a man and you're an abuser, you're no longer a friend of mine. And that's a message we need to spread across generally as men. Like it was said, silence is what kills more people. We need to stop. If you're an abuser and a friend of mine, you're no longer a friend of mine, and we need to keep to that.
Wow. With that, thank you so much for tuning in. Thank you so much to my esteemed guest. I really enjoyed having this conversation with you. We never have enough time. Hopefully, though, the conversation will continue in our audience respective homes and their networks. It never ends here. So let's break the silence. Let's break, the fear of talking. Let's make it more common to speak and to check how we are doing. All the Thando channel viewers, thank you so much for tuning in. We really appreciate your support and your comments. Until next time, thank you so much and good night.
Thank you. Good night. Thank you so much.
Thank you so much, good people. It was a pleasure to have you on board.
But yeah, say easy more.